Hey y'all, I'm Matt Digman.
And I'm an extremely pregnant Roddy, and welcome back to our channel and to another edition of Doctoring the Book's Fast Facts.
We released our debut novel, The Dark That Dwells, in July 2020.
And when we aren't busy working on the sequel, we share knowledge and know-how from our day jobs as pediatric ER doctors in our series Doctoring the Books to help fellow writers add some realism to their fictional injuries and illnesses.
This companion series covers the high points of one particular topic you can use in your writing.
Today, we're hoping to take your breath away as we discuss the subject of asthma.
Most people are at least peripherally aware of asthma. In the US alone, the CDC estimates approximately 7% of adults and 8% of children suffer from it.
But when it comes to asthma's representation in popular culture, it's often presented as one very specific and scientifically unfounded trope.
We've all seen it. In fact, you can probably picture it right now. The nerdy character, anxiety mounting, becomes pale and breathes more rapidly. Hands shaking, he reaches for his inhaler, searching for a dose of nebulized courage.
While that image has been endlessly perpetuated, it's not entirely rooted in fact. Today, we're going to break down how asthma really works so you can use it authentically in your writing.
Asthma is a chronic lung condition characterized by airway inflammation. This inflammation causes the smaller airways to become hypersensitive to certain environmental exposures and allergens. When a person with asthma is exposed to these triggers, the muscles of the airway constrict, making it harder for air to get in or, more importantly, out. This results in hyperinflation or air trapping in the lower airways.
If it's harder for air to get out, that means less space for air to come in, eventually leading to decreased oxygen delivery from the lungs to the tissues of the body, as well as some potential cardiac issues. Asthma also causes increased mucus production, further worsening the obstructive mechanisms at work in this illness.
The exact cause of asthma is unknown, but it seems that both genetic and environmental factors have a role to play in its onset. While it can affect people of any age, it usually starts in childhood.
People suffering from asthma can have coughing, audible wheezing, chest pain and tightness, and shortness of breath. They can have symptoms infrequently or daily, and the severity can range from mild to completely debilitating.
While asthma can't be cured, it can be effectively managed with medications and lifestyle modifications.
But that's not to say it's an insignificant disease. The CDC estimates that 3,500 people die each year from asthma, even in the age of modern medicine.
Like we mentioned, the hallmark of asthma is airway hypersensitivity. But what sorts of things might your lungs be overreacting to?
The list is fairly broad, and asthma triggers, as they're known, vary from person to person. The most common ones include tobacco smoke, dust mites, outdoor air pollution, pests, pets, mold, household cleaning products, respiratory viruses, seasonal allergens, pollen, certain chemicals, acid reflux, physical exercise, cold weather, foods, and fragrances. While stress or strong emotional responses can trigger asthma, this is usually a result of the hyperventilation rather than purely the emotion itself. Anytime someone with asthma is exposed to a significant or prolonged trigger that worsens their baseline symptoms, we call this an asthma exacerbation or an asthma attack.
So, how are asthma exacerbations managed?
Inhaled medications are the mainstay of asthma therapy, and they're used for both treatment and prevention.
Rescue inhalers contain medications known as beta agonists, such as albuterol. These are inhaled bronchodilators that relax the smooth muscle lining the small airways, allowing for better oxygenation and ventilation in an acute asthma exacerbation.
Controller medications, also inhaled, deliver corticosteroids to the lung tissue to manage symptoms long-term and reduce or prevent exacerbations. These medications target airway inflammation and hypersensitivity.
Administration of therapeutic aerosols by inhalation is a practice dating back to ancient times, with the Egyptians being the first documented to ever utilize this modality. In the centuries since, varying treatments have been tried with equally variable efficacies prior to our modern medications.
But if you're writing in a historical fiction or fantasy setting, just consider having your characters use an agent that they know can work to relax the airways, reduce inflammation, and decrease mucus production. Ideally, it should provide that necessary element of realism to draw your readers in and effectively pull off that treatment.
So, what would be a realistic presentation of asthma in fiction?
Agatha huddled in the corner of the crumbling tower's upper floor, sheltering herself as best she could against the biting cold of midwinter. Clutching her chest, She wheezed and coughed, feeling the familiar pressure and resisting a growing sensation of panic. Something horrible would happen soon, and she must escape it. Instead, she fought back her fear and arranged the stones as instructed, carefully tending a small fire in the middle of them. Once hot, she emptied the contents of her pouch on top of the nearest one. Carefully balancing the glass vessel over the fuming powder, she inserted her reed straw through the hole in its top and inhaled deeply, feeling the vapor reach deeper and deeper with each breath. Chest burning, she sat up straighter and reached into her coat, exhaling slowly. She looked down and frowned at the globulous pleura gland jiggling between her fingers. He isn't here to do it for you, she thought. Do what must be done. Suction tube shaking in her hands, she pierced the gland with her needle, drawing up the adrenal fluid inside, and after a short prayer for courage, injected it into her thigh. Tube empty, she leaned in for another inhalation, then fell back against the ancient stone, doing her best to remain calm as the medicines took effect, just as her grandfather had always taught her to do. Well, guys, this concludes our rapid-fire coverage of asthma.
Hopefully, we provided you with some useful information about this common condition and shown you that not all that wheezes is weak and not all nerds need a neb.
If you want to feature asthma in your work in progress and have a specific question, feel free to message us for more info.
And if you have a specific topic you'd like us to cover in a future episode, drop it in the comments below.
As always, please be sure to like this video and subscribe to our channel. Make sure you hit that bell icon for notifications so you never miss a new episode.
And with that, we'll see you guys on the next installment of Doctoring the Book's Fast Facts.
Bye.